All right, part 2 of your introduction to your EMT class through EMT Class Ready. We're going to give you a sample here of medical terminology. This is something that a lot of people have anxiety about. The language of medicine is something that's different than you speak every day. The words, the references, those things sometimes cause, like I said, anxiety, but we can help you understand those, and you will get these in your class. I don't want you to worry. Let's take a look at a couple of things. All right, the first thing we're going to talk about is anatomical position and how we reference parts of the body. Now, this is important because remember, you'll take care of someone and then you'll do documentation. You'll type out your report on your computer or your tablet, and that'll be a record. Anybody reading that report has got to look at and understand exactly what happened with that patient and where their injuries are. So let's see how that's done. Now, the body has a midline. Right? And it's always determined in this anatomical position. Anatomical position basically is someone standing with their palms facing forward, right? Not backwards, forward. And let's see why that's important. Let's draw that midline right down the center of the body, right? That's midline. It makes a lot of sense. That midline splits the body, but also gives us the ability to use the directional terms medial and lateral. Now, the way to remember this is that medial is closer to the midline. Medial, midline. So let's take a look at where this is important. And let's show why it's important to have the palms facing out. So let's zoom in here and take a look at the arm. Now, in this position, remember, medial is closer to the midline. Right here is the medial aspect of the forearm. Now here, on the other side of the arm is the lateral aspect of the forearm. So I've got lateral and I've got medial. Now, why is that important? Let's say somebody gets cut with a knife. And in this, getting cut with the knife, I'm going to switch to a nice red here so we can have an injury. If somebody has a laceration there, it's on the lateral aspect of their forearm. It's farther away from that midline. But if that laceration is here, it's on the medial aspect of the forearm. So, medial and lateral, medial is closer to the midline. Now let's do two other terms, one other concept that we're going to talk about here, and this is proximal and distal. All right? Proximal is closer to the body. It's actually that simple, but there's a reason we do this. Distal is obviously farther away. So let's look at some of our joints in the arm that we see on this diagram and explain why this is important. So let's take the elbow right here. And then let's look at the wrist right here. Now, the elbow is closer to the body than the wrist. That means the elbow is proximal to the wrist. Now, the wrist is farther away from the body than the elbow. So the wrist is distal to the elbow, right? So it's relative, right? Because the elbow, while it's proximal, closer to the body than the wrist, let's look at our shoulder joint here. The elbow is farther away from the body than the shoulder. So the elbow, which used to be proximal to the wrist, is now distal to the shoulder. All right. If your head's spinning a little bit here, this is probably one of the more complicated terms, but let's talk about why this is important. Let's go back to injuries. Let's say I break my forearm. The name of the bones are the radius and ulna, right, in the forearm. If I break my arm right here, that's in the distal forearm. But if I break my arm right here, right, farther up, that's the proximal forearm because it's closer to the body. And why is this important? You're an EMT. You take and you put that arm that's broken, you put it in the splint, you take great care of your patient. And you're sitting down at the hospital after you're done and you're typing your report out, And you say, oh, I had a broken arm. But you can't just say broken arm. You have to say where. That's where the proximal and distal make a really big difference. So if we look at this, we now know medial and lateral, and we know proximal and distal. And those are a couple of the terms that you will need to know as you're going through EMT class. And when you get to be an EMT, you'll use these in documentation. Don't freak out if it seems a little foreign right now, because you'll use these routinely throughout class and in your clinicals. I want to do one more thing before we wrap up this session. I want to talk about medical terminology, the actual words. We talked about positions, location, and description, how we talk about parts of the body. Let's get into some of the words, because EMT Class Ready will help you with those words too. That's that language of medicine that I talked about. It's something that you need to know and does, again, seem intimidating. Now, I'm going to take 3 words, and we're going to talk about breathing, all right? Now, apnea means breathing. I'm going to take 3 modifiers to that word, and we're going to change what this means. Now, if I do apnea, I have A and apnea. A means absent or without. Apnea means no breathing. Patient who has apnea or who is apneic is not breathing at all. But if I have dyspnea, dys means bad or disordered. If I have some patient with dyspnea, they have trouble breathing. They have breathing difficulty. They're still breathing, but it's not going well. And now let's get a little bit deeper on the other side here and get into bradypnea. Bradypnea, brady, means slow. Bradypnea is slow breathing. So do you see how we take words and parts of words, how I can take that and make my breathing word even more descriptive? But I've got a couple other things I want to show you, because brady means slow. Well, coming back over here, tachy means fast. Now, I'll bet if I asked you right now what cardia means, I think you might guess it's the heart, right? So tachycardia means rapid heartbeat. So we know brady means slow and tachy means fast. So if I had tachypnea, that's fast breathing. Bradypnea is slow breathing. Bradycardia is a slow heartbeat. These all come together. And you see how if you know just several of these parts of words, you're going to be farther ahead to start. And we teach you a lot more than this. Well, you know, EMS, you have to have a little bit of gross, right? I can't do this without doing a little bit of gross. You know, everybody talks about this. Hematemesis. Hema, or hemato, means blood. Hematology, right, is a study of blood-borne diseases. Your hematologist studies your blood. Emesis means vomiting. Hematemesis, blood and vomit, means vomiting blood. It's not pretty or fun, but it's real, and you can see even more how these words combine. So in this section of the video, we talked about some basic components of how we talk about and refer to parts of the body, and how the medical language that we use, medical terminology, is out there. It's tricky, but we're going to teach you and get you started on the right foot in EMT Class Ready.